Hello, this is Ulf Landmesser. I'm cardiologist from the Charité University in Berlin. We are here at the ESC 2019 Congress in Paris, and one of the highlights of the meeting is the release of 5 new guidelines for clinical practice. One of the guidelines was developed in collaboration with the European Atherosclerosis Society, or better to say, a joint guidelines between the two societies regarding the diagnosis and management of dyslipidemia. And I think the new guidelines are very interesting because over the past years there have been important novel data, new treatment options coming up, and therefore the new guidelines are very important with respect to implementation into clinical practice. For the lipid guidelines, we have particular the highlight of having a new target in patients who are at very high risk of atherosclerotic cardiovascular disease, and we have also a focus on increasing combination treatment for dyslipidemia, something that we already routinely do in hypertension management, but now comes more important based on clinical trials also in dyslipidemia. In our country, in Germany, the guidelines from the EAS will be translated into a pocket guideline, and the German Society of Cardiology endorses the recommendations, and there are some adaptations that are country specific that then are usually pointed out in a comment to the guidelines, but they are taken up very well. So this is certainly one of the main outcomes also of the ESC Congress here, that the new guidelines will go back to the countries and will be translated into the language in Germany into German, and I think this has worked out very well, and important new information will then hopefully enter clinical management of our patients.